Okay. So welcome everyone. I'm Dr. Soumik Ghosh. I'm joined by Dr. Akash Dasgupta. Both of us are working as senior residents in the Department of Community and Family Medicine, AIMS Devghar. So welcome you all to this video. So why are we making this video and what this video is all about? So I have been getting many messages since the NEET PG result has been out and the counseling is on the way. People are very keen about knowing how community medicine is as a postgraduate branch. And many of the people do not have proper clear-cut idea what are the future prospects. So we thought of coming out with this consolidated video where at one place you can get an idea about what are the diverse opportunities you can have after passing your MD in community medicine. Okay, so now Dr. Akash Dasgupta will explain like why you should watch this video and what are the things we will be discussing in this video. Dr. Akash, over to you.
Thank you, Dr. Soumik. So the main reason why you should watch this video is we feel that so many a times what happen is after giving your NEET PG, many a times you will get a rank between 8,000 and 20,000 and you are confused as to whether to take up a branch like community medicine or pathology or pharmacology or even maybe anatomy, biochemistry, physiology if you have a liking for those subjects. And since you are most of these times you are posted either as an intern or as a house staff, what happens is you go to your fellow PGTs or senior residents or clinical consultants and ask them about these branches. And more often than not, you receive an adverse reaction or adverse feedback about the prospects that these branches hold. So one of the main focus areas and purposes of making this video is to give you the information and message about what community medicine or a MD in community medicine can actually translate into in terms of career prospects from the perspective of community medicine professionals. Okay, and many a times what happens is even when you go and ask to some professionals in the community medicine, many a times you will encounter people who did not choose this subject out of choice but ended up being in this subject 4 or 5 years after giving the NEET PG. So if you are a fresh medical graduate who has appeared in the NEET PG, have a liking for this community medicine subject and want to take it up, what we want to tell you is you would rather take up this branch without wasting your years and put in good quality efforts, academic efforts to excel yourself. And the chances of you succeeding are much higher than going up into other branches after 4 years of struggle where you're already frustrated and tired and not able to put in proper efforts in those branches. The third thing that we wanted to focus in this video is that there are many such videos about the prospects of community medicine, but most of them are made by very senior community medicine professionals who are respectable people, but they have already passed this stage of their career almost 15 to 20 years back. So what we want to provide you is the perspective of an early career professional in community medicine. So throughout this video, we will be including various experts, early career professionals, if I may correct myself, who have completed their MD in community medicine in the last 5 years. And they will come to you and they will explain to you how they ended up in the branch where they are currently, what are their experiences and challenges, and what do they see as their future road, so that you have an idea not only about the MD that you're going to do over the next 3 years, but also how the next 5 years are going to look like. Lastly, there is another course alongside MD in community medicine, which is known as MD MPH Epidemiology. Okay, and that is offered at All India Institute of Hygiene and Public Health. So we would also include one fresh postgraduate who has completed this course and is now currently working as a project consultant at ICMR.
Without further delay, let us start the video and let us call our first expert.
So I would like to now invite our first early career professional that we have with us today, Dr. Bishwadip Chattopadhyay. Dr. Bishwadip initially worked as senior resident in ESI Medical College for a period of about half a year, and then he joined the World Health Organization as Surveillance Medical Officer or SMO and has been working there for the last 2 years. A very good welcome, a very warm welcome to Dr. Bishwadip. So the
Thank you.
first question that I would like to ask him is, so Dr. Bishwadip, how did you get into WHO as SMO following your MD Community Medicine?
Okay, first of all, thank you, Akash, for having me in this platform, and thanks for the nice intro. So actually, after completing my PG in MD Community Medicine, I stumbled upon one application in internet, which is in the WHO's Telis website. Okay, so it's a recruitment website for WHO for both insider and outsider people So one can create their own job profile or profile page in the Stellis website and then can apply for various roles. So I actually applied there, and but the process was so lengthy. So in that 7 or 8 months, I actually enrolled as a senior resident, as you said. So the process
Okay.
actually took around 3 to 4 steps and 8 to 9 months, and then finally I got into the SMO position. Thank you.
Okay. Okay.
So my next question would be, how does a routine week in the life of a surveillance medical officer look like? Like, what are the activities which you are involved in?
Yeah, Soumik, that's a very good question, but unfortunately, maybe it's a question for a 10 marks like long answer format. So I'm trying to like brief it in 2 or 3 minutes. Uh, for surveillance medical officer in WHO NPSN, which is a organization or project that I am part of. So mainly we have 2 or 3 types of works. So if I consider my field works, which is around 60 to 70% of my work time. It actually consists of monitoring various routine immunization, programming, and healthcare delivery system monitoring. And also, I monitor in the fields to see the immunization coverage. Okay, and other type of field works, it contains of the vaccine preventable disease surveillance, fever surveillance, or AFP examinations, clinical examinations, ward rounds in various hospitals to see if there is any missing cases or not. And finally, as and when if there any outbreak occurs, I do the outbreak investigations. And if I come to the outside of field works, which is very, it sounds very less hectic, but actually it's more stressful. It is around doing the advocacy with all the public health leaderships, also in the general administrations that various task force meetings and all those kind of things. And apart from all those things, we have to do regular training of the healthcare workforce, starting from the doctor to the frontline workers, and lastly documentation. Without documentation we can't go in like anywhere else. So that's the thing. That's a typical week looks like.
Thank you for summing it up very briefly, Dr. Vishwadeep. Now, I would also like to go forward. So, you also have to interact regularly with the bureaucracy. Would you like to just
Yeah,
share a
yeah.
little bit about that experience and how challenging it is?
Yeah. The thing is, see, bureaucrats, they are, most of them, unfortunately, are not from our background, not from medical background. So you need to tailor your feedback in such a way that people like bureaucrats, like DMs, like general administrators, like chairmen, commissioners, they can understand. So a very good way to do it is to practice beforehand, obviously, and to summarize or visualize your findings. It's not about the writings but about how you can visualize for them, tailor-made visualization. So I think uh,
So, is that one aspect where the health promotion and education part of our curriculum in community medicine comes to a lot of use?
of course, I would say so, but I would say, in other words, apart from health promotion and education, the better thing is to know public health management. Because for a public health professional, uh, apart from the clinical acumen, you need a very good management skill. And so, all the theoretical frameworks that we have learned during our PG times, it comes into fruition towards my working hours and all these things, because you have to manage the bureaucrats. It's the one liner sentence.
Thank you so much. Last question is to a budding career professional who would like to explore this branch. What are the other opportunities in working in international health organizations, and what are the future prospects in terms of the progressing the career in international health?
Yeah, so that's the $1 million question, because I also was trying to know the answers when I was getting into it. So there is some good news and some bad news. Okay, so one good news is, when you are trying to enroll or apply into any type of international organization, once you get in, you have lots of access to many types of peoples. be it within your organization or outside. So one type of career prospects is just stepping up the ladder, okay, within WHO. And apart from that, that WHO or UNICEF, it actually holds a lot of good stamp in your CV, right? So whenever you are going for any interview, I think it will be of great help. And apart from that, as you know, or as you see the backbone of the industry, health industry in your own eyes, like you know how the health programs works. So it is very easy to apply for any type of works which handles with the health programs like NHSRC, and maybe outbreak investigation organizations like NCDC. There are lots of jobs. You just have to keep open your eyes. But the con, there is also con. When you are going to this type of international organization, you need to be so proactive because most of the jobs are not permanent. And in this shifting public health landscape, you need to be aware of where you can go, and you need to always develop yourself, which is, I think, in a way it's a good thing also. So that's that. Career prospects are lot, there are lots of career prospects, but you need to hone your management skills. That's the thing, that's the ultimate thing.
Thank you so much. Thank you, Dr. Vishwadeep, for your valuable time.
Thank you so much.
We will try to get back later for a more elaborate insight
Yeah.
on.
We
Yes,
need
thank you.
elaboration. Thank you, Soumik and Akash, for having me for in such short notice. Thank you.
Thank you so much.
Welcome. We have Dr. Deepankar Jana. So he, after passing his MD in community medicine, is currently working as a public health specialist at Port Health Organization, Kolkata. So Dr. Deepankar, I would like to ask you that why did you choose to become public health specialist at the point of entry after you passed your MD in community medicine?
Uh, Good question, very good question. Because after passing community medicine, we always think in which line we have to choose, in which way we have to take. So after passing my MD community medicine, there was two options. One is teaching option, that is either senior residency, and another one. Luckily, our time we found that few post of public health specialist vacant in port and airport. So always I was interested in work in the field, public health field, rather than teaching. So because I always interested in work in the public health field, that's why I choose public health specialist post in the port area, because port area has lots of field related activities that always I incline to in that section. That's why I choose in the line of public health specialist rather senior residency.
Thank you. Akash, now.
Thank you, Dr. Dipankar. So the next question is being a public health specialist at port of entry, what are the routine activities relating to public health field work that you have to do in your day-to-day work?
In Port Health Organization, that comes under Directors General Health Service under Ministry of Health and Family Welfare. It is a field unit of field unit of ministries point of entries. In that field units, we have to obligate all those mandates of international health regulation. In that international health regulation, major mandates are the ship related activities where we have to screen international crew and international ships. Apart from, we have vector surveillance activities that covers mosquito control, Aedes mosquito controls. After that, we also do routinely sanitary inspection, water surveillance, and vaccination, yellow fever vaccination and OPV vaccination. Those are the major mandates and routine activities we cover in our day-to-day activities.
Okay. Thank you for a very honest opinion. I think this will help our aspirants to take a clear decision after this. So with this, we would like to end this conversation.
Okay.
Thank you. Welcome. So we have with us Dr. Sujit Sunandan. So who, after passing his MD in community medicine, is currently a CGHS medical officer, Central Government Health Services medical officer. Okay. So welcome, Dr. Sujit. So first question I would like to ask you is, when did you decide about giving this UPSC Combined Medical Services examination, and when did you clear it actually?
Okay, thank you, Dr. Soumik, for the welcome. So actually, I had given UPSC CMS exam during my NEET PG days only, like when I was trying to crack NEET PG. That was my first attempt. After that, I got into NEET PG. I got into an institute, and but that time I couldn't fully crack it. I couldn't come in the final list. So I joined MT Community Medicine. Then during my second year, so I again tried to apply for the exam. since I saw there were like 1,000+ vacancies. So I just gave it a try. Like since it only had the final year subjects, I thought I could do that. So I applied for the exam and I gave the exam, and that interview also went okay. So I got somehow selected, maybe also due to the high number of vacancies that time. So I got selected, and during PG, then I applied for my extension and kept the job till I completed my PG exam, PG course. That is, yeah, that was my journey.
Just continuing from that answers, Dr. Sujit, that how did you manage to get that extension in service? What is the procedure for that? And how did you rejoin back after completing your MD?
Oh, okay. Dr. Akash, actually, the procedure is easy if you meet the certain criteria. So I gave it during my second year. So I'm already enrolled in a PG course. So the criteria for CHS extension is that you must be either allotted a PG college, or you should be studying in a PG college. So either that you can apply for extension, and the added criteria is that there should not be any bond after you complete your PG course. So that is the thing. So once you get your appointment letter from the CGHS, they give you 15 days. So in that period, in that 15 days, you should be either be in a college, or you must be allotted a college in that 15 days. So that is the deadline, kind of like after that, you cannot apply for extension. That is the problem. If you are not selected for PG, then you cannot apply for extension. So
And if I got you correctly, like it has to be a college that does not have a bond.
a very bond, yeah, because they give you extension, but it is specifically mentioned that after like the extension period cannot be used for doing any SRship. So we cannot do that during extension. So and coming to your question, the second part of the question, the rejoining part. So that is like once you complete your PG course, so there is a like 3 years mandatory you finished off, then you can send a revival letter, and that has to be done like after the course end within 45 days. So within 45 days, you just give them a letter that I want to rejoin back, and they will approve it within 2 to 3 months, depending on the ministry. So there are different ministries. I'm not going to tell about all
Yes.
those things, but yeah, that is the thing.
Right. Thank you, Dr. Sujit. So, final question to you is, what is the career progression in this field as a CGHS medical officer in terms of both job security and financial security?
So Dr. Shomik, like it's a government job, so job security and financial security, that is okay. That is there. That is not a problem. And about career progression, specifically speaking, this cadre, GDMO cadre, offers DACP. So it is like assured career progressions, dynamic assured career progressions. So there are specific milestones, like 4 years you become a SMO, then after 5 years you become a CMO, then after again 4 more years you become CMO NFST, then 5 more years, like within 18, 20 years you become an SAG, then 25 years HAG, like that the progression goes. And the particular thing about this progression is it's not competitive. It's like assured progression. No matter what you like, there is no like publication limit or something like that. It is not there. So you are not assessed before promotions. If I want to oversimplify it, that is the way. So you are assured promotions every year wise. Like how much ever years you work, you get promoted, and the pay scale also rises accordingly.
Thank you.
So
So,
yeah.
thank you for your valuable insights. I hope our aspirants will be benefited from this.
Okay.
Okay, so we have with us Dr. Nidhi Shri, who is currently working as an assistant professor in the Department of Community Medicine at ESIC Medical College, Pandipur, Varanasi. So, ma'am, our first question to you is, how is the life of a medical educator post MD Community Medicine?
Okay. Nice question. See, after doing MD Community Medicine, you have a choice of becoming a medical educator in many areas. Like you can join a medical institution, teaching hospital. There you'll have a teaching role, plus a researcher role will also be there. Sometimes you have administrative roles also, because you have to take care of RSTC, USTC, and sometimes there are some committees which are made in the institutions, like infection control committee. So these types of committee, you'll be a part there. So there, it is a versatile role. So whatever you learn in MD community medicine during 3 years, it is going to be fruitfully utilized. Then you can join in other institutions as a medical educator, like one of the public health institution. It is AIHPH is one of them. Then you have NIHFW. There are many institutions like that. So you can join there also. So the students will be of different types, but you'll have a role of medical educator and administrator and a researcher there. Then we have ICMR institutions. There also you have opportunities. So it is a versatile field where you have lots of opportunities. So,
Thank you, ma'am. Just a
Thank you,
follow
ma'am.
up on
Akash,
that.
over to
That
you.
how easy or difficult is it these days to get a teaching job post MD?
okay, again a nice question. Thank you for the question. See, easy or difficult, it depends upon your caliber, how much you have learned. If you have the eager, means if you're eager to learn more and more, you will grow in your branch, any branch if you take. So now coming to the opportunities. Now the government of India has launched many medical colleges now. So there are lots of medical colleges which are coming up. State autonomous government medical colleges, and then you have central government colleges as well. So opportunities are going to increase only. If you take this branch, so you'll have a security, job security always. So opportunities will increase with time.
So the next question is like, what are the future prospects and the promotion structure in the life of a medical educator after MD community medicine?
Okay. Okay. Thank you. Thank you, Soumik, for the question. See, half of the answer I've given in my previous replies only. That when you become a medical educator after doing MD communities medicine, so you have lots of opportunities. But as per the curriculum laid by the NMC guidelines, you have to do senior residency, then you have to do you become an assistant professor, then you become an associate professor, then you become a professor or an additional professor, then professor HOD. Sometimes you can have other administrative roles, like you can become medical superintendent of the institution, you can even become dean director. So this is the hierarchy what I'm telling you. But again, your contribution and your work ethics and how much you can give input into the work, that will make or mark how much forward you're going to go. So what I want to suggest to the budding people, that always do SRship. When you have completed your MD community medicine, go for 1 year SRship. So new NMC guideline has though come recently in July, saying that people who have joined hospitals, which is not a teaching institutions, and it is more than 220 bedded, then experience of working in a hospital for 2 years continuously will be counted to become an assistant professor without doing SRship. But that is an additional way. Like I am working in ESIC. So in ESIC, there are medical hospitals, many places, which is not having teaching facility attached with it. So people who have been working after doing their IMO grade and they have done MD community medicine and they're working for last 2 years, so they can be promoted to assistant professor role. So that is one benefit which has been then modified by the government to bring most of the faculties to the teaching area. So that is one thing. Rest, what I want to suggest, that when you are in the field, uh, the years which are there dedicated for the promotion, please be continuous. Don't give a break in your career, because many a times many students, they have their personal problems or personal activities going on, so they sometimes give break. But I'll suggest, don't give a break and continue your career. You'll have a very very good growth, because there is a feeling of growth there. When you're growing somewhere, obviously it will help you build up your character. That is it. Nice to meet you all. Okay.
Yes, same
Anything
here.
you need, you can always keep in touch. I'll let you know
Sure,
anything is
sure.
happening.
Okay, ma'am. Thank you
Okay.
so much.
Thank you
Chalo.
so
Thank you
much.
so much.
Thank you.
Thank you.
Welcome, welcome,
Bye.
and all
Bye,
the
ma'am.
best.
Bye. Good night.
So next we are joined by Dr. Shondipta Chakraborty. Dr. Shondipta sir has not only completed his MD in community medicine, but also has done a master's in public health. And he has diverse experience of working at ICMR for a period of time. He has also worked in various field level public health organizations with both NGOs as well as international organizations. And currently sir is working as assistant professor at IIHMR Delhi, which is a teaching institute for teaching health management and masters in public health to allied healthcare professionals. So we welcome Shondipta sir. And the first question that I would like to ask sir is, sir, since you have exposure of working at ICMR, what are the research related job prospects post MD in community medicine?
Thank you, Dr. Akash and Dr. Soumik, and thanks for the kind introduction. So, if I talk about the research perspective after MD community medicine, you first need to think in the international context, the present trend of medical science, that research has a big role everywhere. But unfortunately, if you talk about the Indian context, even in the undergraduate, even in the postgraduate, the scope of learning research is very less. I know people do research, but doing a research and doing a research perfectly, there is a difference. Perhaps community medicine is the only subject that taught us a very good research methodology, epidemiology, biostatistics, which are, you can call, the heart of research. So by itself, if you are a community medicine postgraduate, then you have been given those skills by virtue of the degree. Now, the second thing is that if you talk about the scope of work in ICMR, the Indian Council of Medical Research, as you know that in the government sector, this is the biggest platform of doing medical research. It is not only confined to the public health, it is also related to other areas of medical research, medical diagnostic techniques. So the good thing about working in ICMR that you will have lots of opportunity to work in various aspects, whether it's a maternal and child health or non-communicable diseases or communicable diseases, including the newer concept of One Health, medical diagnostic sectors, clinical research. So every aspect. So you have to first of all identify that your area. I'm not talking about only public health research, because even after community medicine, you may choose something beyond a pure public health research. You can simply go with clinical trials. So ICMR, with all of its institution across the country, so they serve various aspects. So whatever I said, even beyond that, they have nutritional areas of nutritional research also, some recent innovations like application of drone technology, and time to time they advertise new positions. Now, people may say that after MD community medicine, if you want to join in ICMR or some peripheral institute which is under the council, you need to join as a contractual employee. That's true, but you have to start now, and that could be a very good platform for you for your future. Now also ICMR and DHR, that is the Department of Health Research, see, they are also offering some grants and funds for young scientists. There are scope of doing PhD under the umbrella, specifically for women researcher also. They are giving specific funds. So there are scope. You have to utilize the scope and you have to be positive. Okay. I can understand that most of the jobs that they are offering right now for the freshers are contractual, but that's fine. You work there, you gain your experience, and the most important thing in research and public health also is networking. Research is nothing that you can do in silo or you can do independently. If you want to do good research, you need a lot of networking and multi institutional involvement, and that is only possible if you are working in a bigger stage and you develop the network. So it's a very good time, I would say, for those who are working with ICMR for learning, for development of their research career, whatever area they want to choose, and also development of network and future academic prospects. Yes.
Thank you, sir. So the next question is, like, many of us have this notion that after MD community medicine, we only have the scope of teaching MBBS students. But since you have this diverse experience of teaching MPH students as well, so how is it different from teaching MBBS students?
Okay. So let me let's recall my experience over the two IHMR institutions that I have worked. So I started my journey with IIHMR Jaipur University, where we had the international MPH course, and I was fortunate enough to teach some of the medical and paramedical graduates who are from African and Middle East countries. Okay, and I also taught like people who are doing executive MPH. Now, very interestingly, there are few people who are very senior in the area of public health. Some of them have like they are medicos batch, like the entry in MBBS batch is the same year when I was born. Okay. Apart from that, both in IHMR Jaipur and IHMR Delhi, we are teaching students of MBA or postgraduate diploma in healthcare management, hospital management, and health information technology, digital health. So these courses are all more or less similar. Now you have to understand that MBBS is a professional course. It is strictly confined to the concept of medicine. Yes, when you teach MBBS students, being a community medicine expert, you will be teaching them community medicine. That I can understand. But if you consider the scope of community medicine, it actually covers the area of health, which goes beyond medicine. which covers the social determinants, economic aspect, the communication. So, there is a definition of public health which says that art and science. But what I wanted to add always with that, art, science, and commerce. Because public health requires a lot of understanding of health economics, general economics, and the economic situation of a country, political situation of a country. Now, beyond this MBBS curriculum, if you teach in a MBA or postgraduate diploma course for healthcare management, hospital management, digital health, and also MPH, all these courses will give you that scope to go beyond the area of medicine. And moreover, learning never ends. They are also, when I teach those students, some of them are from varied background, even our other faculties also, they are from varied background. So I always see that as a very good opportunity to learn. Because in health, if you want to work in health, and which community medicine also gives you, you have to go beyond the concept of medicine. Because just for example, if you think about behavior change communication, social behavior change communication, just being a medical professional, you can't do that. Again, you need teamwork. And with the scope of teaching these kind of students, the students can be your colleague in future, and also your other colleagues who are working in the other sector. They can be your team members for your research. And if you specifically talk about the difference between teaching MBBS, because I also informally have taken some class of MBBS students, and especially during the MD curriculum. The difference being that here it is more practical oriented implementation of. In MBBS, obviously, we teach, even if you talk about the post graduation, yes, practical aspects are there. We also teach them a lot of theories. It's almost equivalent to PhD that I consider always. Specifically, if you consider MD community medicine, it is never ever anything less than a PhD degree in terms of research methodology. Okay, and I'm fortunate that in our institution they also consider the same. It's not always there. I have seen a lot of institutions, they prefer PhD, but in our institution they consider MD community medicine as equivalent to someone who is having PhD. And but if you talk about teaching the MPH and MBA or PGDM students, then you have to be more practical oriented. So where you need to apply your practical experience and experiential learning. So I feel that I'm quite fortunate, because after my MBBS, almost for 8 years, I worked with different public health programs, be it NRHM, in a peripheral PHCs, be it like a block medical officer, a research officer in HIV surveillance system, or maybe a dengue surveillance project under ICMR. And even after that, after my MPH, I also worked with CARE in the maternal and child health. And one of my most exciting experience with Medicine Sans Frontiers in Manipur, working with HIV, TB, and hepatitis patients. So all these experience helps me to teach the MPH and PGDM student the practicality, the real life situation where their managerial role is needed a lot. So this is a difference, you may say, that from a core theoretical thing to a practical and more managerial thing you need to teach when you are teaching MPH or healthcare management MBA students.
Thank you so much, sir. I think the key takeaway from your thing is that at MBBS, we are probably considering a lot on medicine. But when we are exploring these
Yes.
allied health branches, we are really dealing with health per se, which is not just involves the diseased, but everyone. Yes. So I will just, though you have covered a part of it, I would just like to go to the last question, which is, so what are these other avenues that a MD pass out can explore other than in academics and in teaching?
Okay, fine. Being a medical doctor and with a degree in community medicine. Now, that the name of degree, like earlier it was preventive and social medicine. Now it is community medicine. In some of the institutions, they are also offering community and family medicine. So truly speaking, we really have a big scope here. Now, it totally depends on personal choice. There is no harm if someone, after completion of community medicine, just want to work as a general physician or a family physician. There is no harm. And with the lens of public health and community medicine understanding, if someone works as a general physician, they can also contribute in a better way. That I believe. So that is first option. Or not the first option, it is one of the options, because I know a lot of people prefer doing physics. The second thing is obviously teaching and research, what you have mentioned in the medical colleges, but beyond that, there are a lot of scope, and which perhaps out of a few subjects only community medicine gives. One is like teaching beyond the medical subject areas, like in public health, teaching MPH students, MBA healthcare management students. There is a huge scope now which is coming in the cross-sectional area or the cross-cutting area of health and AI and digital. Now, remember, if you can acquire some knowledge in data analytics, which is also a part of our subject in community medicine, and some ideas about application of AI, because in future we have to apply AI, big data knowledge, and like only with data knowledge is not sufficient for the application. We need the background medical knowledge. Also, we need the research knowledge. And community medicine is perhaps one of these unique areas. This is completely my personal feeling that days are coming when the community medicine will be very highly rated if we can properly incorporate this digital health concept in community medicine with application of AI. Because then we'll be fulfilling all three criteria: basic understanding of medicine, understanding of preventive medicine and public health, and data analytics with AI. So that is one area which is an upcoming area. Even I am also trying to develop my skill in these areas, and I will suggest those who are pursuing community medicine to have some knowledge. There are a lot of courses available. You can learn Python, you can learn art, you can learn data analytics with other softwares. But yes, remember, before learning the software, make your concept very clear. The basic concept of epidemiology, biostatistics, that will only help you. Just learning multiple software without that concept will not help. Beyond that, like teaching and research, beyond that, there's a huge scope in implementation. Because I have been an implementer in the early part of my life, and what I believe that there is a bias in our fraternity also. For example, say if I ask you who is a very good surgeon or a medicine MD, medical doctor in your area, whom would you like to identify? Someone who has a very good research paper or who does very good surgery or treat patients?
Okay.
Now, there has to be a balance. It's not only about treating patient or doing research, but in our area, if you see, when you go for the conferences, most of the cases, we give a higher weightage to people who are doing research. Yes, research is needed, but along with that, implementing the research is very much needed. So that's why we need to also call those implementers. And some of you who are pursuing community medicine will be listening to this video. I would suggest try to be an implementer at least for a few years. Then the option of research is always open. You can also do implementation research. That is a very interesting area. That is a overlap of research and implementation both. So weightage that we give to the people who are doing research, we don't even give the half of the weightage to those who are implementing those things, especially in the government sector. If you talk about those working as a DMOH or CMOH or deputy CMOH, those levels, because in the conference time, we call people to present research paper. We never call. I have at least never seen calling people to present their real life stories, the case studies. That is also important. You can consider it is similar to being a good practitioner in medicine. A good practitioner need to have some research publication. I agree, but there has to be a skill to manage patient properly. In public health also, that skill of managing patient, if you just compare, it is equivalent to managing programs efficiently. So we need to listen to them, and we need to accept one thing also. You just can do research and let the other people, like who are working in the peripheral setup and also the frontline workers, just to implement the program according to your research plan without you giving them enough support or handholding. But how you could offer the support? The only option of offering support is that uh, if you are working in some implementation projects for few years, so you can work in implementation project early in career for few years. Options of doing research in parallel is always open, and you can after that you can join. Initially, we talked about ICMR, about the research prospect, and it is not only ICMR. Like the institute I am working, they are not only a teaching institute; they are a research institute. That is a recognized institute, collaborating institute of ICMR also. It is IHMR Delhi. They also offer positions like research officer. IHMR Jaipur also offers. There are institutes like Society of Advanced Studies. So we have a good number of institutes. They also offer research position. And if you are coming to research after having all those field experience, that will give you an extra advantage. So if you talk about the opportunity, teaching, research, field program implementation, working with NGOs, and one more thing that I prefer, that is the field of humanitarian medicine, which is very close to public health. Organizations like International Red Cross Society, Medicine Sans Frontiers, Medicine du Monde, they also offer. Those who want some excitement in their career, they can plan for that also. They can even visit some countries in some remote areas. Okay, maybe for 6 months, 1 year, 2 year, and then they can again come back. So these are the options. The options are plenty, but you have to be patient because things will come, but everything needs some time.
Thank you so much, sir, for your diverse and like putting the diverse things in a very crisp and nice way as well. Thank you so much, and we hope to have future conversations with you in more detail. Thank you.
Okay.
So, welcome. We have with us Dr. Nandu Krishna, who has completed MD, MPH epidemiology and he is now currently working as a senior consultant in an ICMR funded project. So welcome, Dr. Nandu. So the first question to you is that many people, while applying for the NEET PG counseling, they are sometimes confused about this MD MPH epidemiology course. So if you could throw some light on this course and what is the curriculum like, it will be helpful for the students to choose this option. Dr. Nandu.
First of all, I would like to thank Dr. Soumik for inviting me to give this lecture, and also I would like to thank Akash for moderating the session. So I would like to start by saying that this is a parallel sister course, just like community medicine. This is a very new course that is set up by NMC in 2016, and the first batch of the students passed out from All India Institute of Hygiene and Public Health in 2019. So we are currently up and running for the last 6 years, and the course is basically designed to produce public health professionals and epidemiologists specially curated from the medical stream. So we do have community medicine field as such in India to promote such a field, but there was a need of more curated epidemiology courses, and epidemiologically driven courses was a need of the hour in the 2015 to 2020. As you all know, the COVID hit, so we all understood the role of epidemiologist in the public health sector. So this course is a broad specialty course in the NMC, which is a 3-year normal MD course, and the nomenclature is MD MPH epidemiology. So coming to the course curriculum, we are having a full-fledged public health course that is starting from the research methodology, biostatics, epidemiology, maternal nutrition, occupational health, developing with all the domains of public health. And the difference, I would say, from community medicine is it's a little more oriented towards the practical side of the field. That would include a lot of public health surveillance included, a lot of outbreak investigations, the analysis of the health situation data that is there in the districts or state. So it is a purely a sister concern of community medicine, I would like to say.
Thank you, Dr.
Over to
Nandu.
Akash for the next question.
Yes, for those of you who don't know, the Dr. Nandu initially worked at Airport Health Organization for a few years, and he handled the COVID-19 pandemic at one of the most important airports. And then he joined at All India Institute of Hygiene and Public Health for the MD MPH course. So, Dr. Nandu, what are the future prospects of like career prospects after completing MD MPH epidemiology?
Yeah. Thank you, Akash, for that question. So I would like to stress on all the aspirants who are watching this session that this course is basically to carve out the public health specialist and epidemiologist who are very much interested in the field level jobs out there in India and abroad. So as you all know, MPH is a very valid and highly sought after course, not just in India, but globally. So we, after MPH epidemiology, many of my seniors have joined as senior residents. So the usual course, just like community medicine, could be a senior residency, and there are public school of public health which are there in many different aims, which are providing SRShips, and also the community medicine departments in both state and government medical colleges and private colleges are giving out senior residencies for the same, which in turn will help you to become an academic faculty in a college. So the field side where we are practically trained would be to become a public health consultant, just like where I'm working. So that can be as a research scientist in any of the research organizations in India, like ICMR or PHFI or NIN. So many of the even all the aims where these projects are being run also provides these research scientist posts. The administrative part of it. So the course also provides a lot of managerial exercises and expertise to train you to become a superintendent in a medical college or a hospital. Many of our seniors are currently working as superintendent in medical colleges and hospitals. So the next arena where we could work is in the pharmaceutical companies, where you can work as an epidemiologist or a medical coder. So this is also a very, very sought after field in epidemiology, and all the government organizations and NGOs have a specific post which is reserved for epidemiologists. And as you want to have a better in-hand feel, NGO would help you to be in the field and also get that in-hand feel of what public health is.
Thank you, Dr. Nandu. So our final question to you is, now you're working as a senior consultant in an ICMR funded project. So like after passing out an MD and MPH epidemiology, what is the procedure of getting into this role? And what are the future prospects in this role? So if you can throw some light on that.
Yeah, thank you, Soumik. So first of all, as I have directly applied for a post just after my MD course, the particular post needed prior experience as a in the managerial role, which I already had before my MD course. So that was one of the advantages that I had. But during your course of MD, MPH epidemiology also, you get to get exposed in the district surveillance unit in one of the districts in Calcutta and nearby areas, where you are posted in the district surveillance unit to get to know about program evaluation, secondary data analysis, health situation analysis, outbreak investigation. So all these adds to your CV. Also, during the 3 years, my institute has helped me to foster and produce some good academic publications, which has helped me to get into this particular route. So if you are a budding public health specialist, then I would suggest you that you should work more on academic publications and to get more in-hand field experience to get into a post of public health specialist or a research scientist or a public health specialist. The future prospects, as the second part of this question, I would like to say that there are a lot of projects that are coming up in India and also outside. So as a senior consultant, the initial process of being in the project is you are trying to manage the project, you are trying to liaison with the state government and the central government and other technical teams like Dell, NHSRC. So these are big organizations that deal with research. So as you are into the research field as a epidemiologist or a senior consultant, the NGOs are one of the biggest places where you can get placed, and that would also include all these United Nations NGO like UNICEF, UNDP, WHO, etc. So yeah, so the public health is a very broad domain, and you can always specialize yourself into each specific domain, like maternal or child health or nutrition. So that takes you infectious diseases, non-communicable diseases, digital health. So these kind of things help you move to that specific domain a lot further.
Thank you, Dr. Nandu, for that cheerful and insightful conversation. So I think our aspirants will get a lot of clarity on this course of MD MPH epidemiology after this conversation. So we have with us a junior resident who freshly joined last year, Dr. Rachit Harode, who is currently a first-year junior resident, soon to be second year in the Department of Preventive and Social Medicine of All India Institute of Hygiene and Public Health, Kolkata. So welcome, Dr. Rachit. So our first question to you is, why did you take up this branch of community medicine? So would you share your insights?
Thank you, Dada, for having me. So taking up community medicine. I will say two main reasons. Firstly, previously for 2 years I was working in the tribal rural area, as a medical officer. So there I got to know more about the other dimensions of health that we don't usually get to talk around in our UG days. The infrastructure, how it works, how the administration works, and everything. So that got me intrigued, and that got me into it. And secondly, I personally love the social aspect of health and social aspect of life. So I had a passion about it. I had an interest about it. So that's why I joined it. Also, I was not much inclined towards clinical, to be fair.
Thank you, Dr. Rachit. It's very refreshing to have young career professionals like you who are looking into the social aspects of health, working in the rural areas with tribal health and getting interested in this subject. So the next question that I would like to ask you is, how does a typical day, or say how was your experience in first year as a postgraduate student in All India Institute of Hygiene and Public Health, or say as a postgraduate student of MD in community medicine?
Yeah, so the experience has been amazing. To be honest, it has been very refreshing, very different. Firstly, for a good amount of time, for 4 to 5 months, we had our classes brush up on our UG/PG curriculum, and then along with that, we would go to OPD postings. We have our two areas. One is rural area and one is urban area. So we have two health centers there. Designated days are there to go there and to of a OPD. And then when in the department, when we come, it is more like we have our JCs, journal clubs, presentations, and All India Institute of Hygiene and Public Health Kolkata gives an exposure to this unique thing called PHI, public health postings, public health institutional postings. So we have been to border, we have been to point of entries, then we have been to GMSD, which we never knew about that. What is GMSD? What is Government Medical Store Depot? A very strong backbone. We have been to ports, as I said. So it has been an amazing experience overall. Along with that, we do our research work, data collection. But yeah, at the end of the day, around 5, we are at our home. We can either study, we can either pursue a hobby. We don't have emergencies, so we can be very free. So that is more or less a day in hygiene or a day in president of community medicine looks like. Thank you.
Thank you. So that was a very refreshing take, and you highlighted on the concept of work-life balance, which is quite missing these days in many people's professions. So our final question to you is, what is your future plan? Like after passing out from All India Institute of Hygiene and Public Health, what do you plan to do?
Yeah, so initially joining, at the time of joining, I did not have much idea. A little bit of idea. I wanted to go into the research aspect, but then when I came here, I saw all these things. I get to learn new things every day. So my plan also changes somehow. Sometimes I want to go into administration. So I'll just brush up on what I think I can do or I would want to do in future, wherever life takes me or wherever my interest takes me. So maybe administration. I have always had an inclination towards research work. To join, we can join a government research if uh, we go there, or any private NGO or a government setup. We can take up SRship, we can get into teaching, we can get into academia. And one thing about community medicine is like academia is different. You know, you get to teach, but you also get to do research. So that is also very interesting prospect. Plus, you get to go to the people in need, to the area, to rural area or to tribal areas to actually make an impact from the ground level, from the base level. So these are more or less my prospects, which I've been looking forward to.
Thank you so much, Dr. Rachit. Thank you so much. So
Thank
some
you.
of the people who will watch this video will probably join as your juniors.
Yeah,
So
for
Yes.
sure.
guide them well and wish you all the best for your future. Thank you.
Yeah. Thank you, Dada.
All the best.
Thank you so much.
Thank you for your time.